Hello everyone. Did you know that the liver does almost 500 functions every day to keep you alive? It is the largest glandular organ in our body and performs multiple functions like producing glucose and hormones, storing up vitamins and minerals, removing bacteria from the blood, metabolizing the drugs, etc. It also has a remarkable ability of regenerating itself. However, hepatitis is a disease that can affect and damage the liver. We have almost 40 million people living with hepatitis B in India today and almost 12 million people living with hepatitis C. As we celebrate World Hepatitis Day today with the theme of One Life, One Liver, I just want to give you all some basic information about what viral hepatitis is, what causes it, how to detect it, how to prevent it, and how to treat it. So firstly, what is hepatitis? In common language, this is referred to as jaundice, or in Hindi, it's called pilia or kamale in Kannada, etc. However, this is just the symptom of jaundice wherein a person's skin, eyes, urine, etc. become yellow, and this could have various reasons. One of the reasons for this symptom of jaundice is viral hepatitis, about which I will be talking to you all today. Hepatitis is a disease which causes inflammation and damage to the liver. There are 5 different types of viral hepatitis, ranging from hepatitis A to E. So hepatitis A, B, C, D and E. Each of these have different routes of transmission, different clinical features and clinical progression, and different prognosis as well. Hepatitis A and E cause only acute infection, whereas hepatitis B, C and D can cause both acute as well as chronic infection. So firstly, let's talk about hepatitis A. It is the most common type of hepatitis and spreads through water or food which is contaminated by the infected person's stool. It causes acute infection, which means that it is self-limiting and gets better on its own within a few weeks and usually does not cause any lasting liver damage. A patient will usually present with symptoms like fever, tiredness, nausea, vomiting, abdominal pain, loss of appetite, etc. It can be detected by a blood test which looks for IgM antibodies of hepatitis A. Presence of IgG antibodies would mean that a patient has been infected previously or he is immune to hepatitis A because of the previous vaccination. So how do we treat hepatitis A? Like I said, there is no specific antiviral therapy as such. The main treatment includes rest, fluids if needed. Some people may require intravenous fluids as well, and eating a healthy and balanced diet. It is good to avoid alcohol and avoid any foodstuff which is very rich in fatty content. Also, you should always remember to avoid taking any dietary supplements or complementary medications without the advice of your doctor, because those may result in liver damage as well. So how do we prevent or protect ourselves from hepatitis A? There are 2 main things that we can do. First thing is hand hygiene. Make sure that you wash your hands before and after handling food or eating food. Wash your hands before and after changing diapers of an infected person. And also make sure that you wash all the vegetables and fruits in adequate amount of water. This is one thing that we can do to protect ourselves from hepatitis A. The second thing that we can do is vaccination. So hepatitis A vaccination is given to all children above 1 year of age, and even adults can be vaccinated against hepatitis A. The dosage is usually a single dose followed by a booster dose 6 months later. So these are 2 methods in which we can protect ourselves from getting hepatitis A. So now let's talk about hepatitis B. It can cause both acute and chronic infection and spreads through the blood, semen and other body fluids. So the main routes of transmission include intravenous drug abuse, IV injections, blood transfusion, unprotected intercourse with an infected person, tattooing, etc. It can also spread perinatally from the infected mother to the baby during birth. In an acute infection, the symptoms usually last for up to 6 months, and if the person's body is able to fight against the virus goes away. Most healthy people recover from an acute infection without it progressing to chronic. However, if the body is not able to fight against the virus, it may persist and continue to become a chronic infection. Normally, a chance of hepatitis B infection turning chronic is more if you are infected as a child or a baby. As we get older, the chance of the acute hepatitis B infection turning chronic becomes lesser and lesser. How do we detect hepatitis B? It is through doing a blood test wherein we look for hepatitis B surface antigen, that is HBsAg and HBeAg as well. So what are the symptoms of hepatitis B? Normally in an acute infection, it is similar to hepatitis A, wherein the person may present with fever, tiredness, jaundice, vomiting, etc. However, a chronic hepatitis B infection is mostly asymptomatic. It can, although, lead to complications like liver cirrhosis, liver failure, and it can progress to liver cancer as well, which is the main danger in getting infected with the hepatitis B. What is the treatment for hepatitis B? Acute hepatitis B infection again does not have any specific antiviral treatment as such. Treatment is similar to a hepatitis A infection in the form of rest, IV fluids, and a healthy diet. A chronic hepatitis B infection is treated with antivirals like entecavir, tenofovir, etc. What is more important for us is to understand the preventive methods for hepatitis B. Here again, there are two things that we can do. First and most important thing is getting ourselves vaccinated against this virus. It is included in the national immunization schedule. All children are vaccinated in the first few weeks of their birth. Adults also have to get vaccinated if you have not been vaccinated as a child. It is usually given in 3 doses at 0, 1 and 6 months. The second method is protecting ourselves from exposure to blood and body fluids, which includes wearing gloves, using disposable syringes, using condoms and protection, etc. So next, talking about the rest of the hepatitis viruses, that is C, D and E. So hepatitis C has very similar disease profile like hepatitis B itself. So it is the same routes of transmission and the same methods to protect ourselves. However, there is no vaccination for hepatitis C as such. Hepatitis D is not very common. A person can only get infected with hepatitis D if he is already infected with hepatitis B. Hepatitis E also causes acute infection and is very similar to the hepatitis A infection. So here again, the preventive measures includes hand hygiene, washing of the food and fruits and vegetables, etc. Again, there are no vaccinations against hepatitis C, D and E as such. So I hope that this short video has given you a basic idea about the different types of viral hepatitis and the main things that we can do to protect ourselves. Do remember to get yourself and your loved ones vaccinated against hepatitis A and B. Do follow hand washing techniques and hand hygiene, and do make sure that you are not exposed to any blood or body fluids without wearing protection. Thank you and have a good day.